Okay, wake up. Are you the one that needs the x-ray?
Who are you?
Well, I'm the radiographer, and I can do your x-ray, but I'm not, did you need an x-ray? Did they say if you needed one?
I don't know who or what you're talking
Okay, well,
about.
I'm really busy right now, so I'll have to come back later. No, 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 that is unacceptable. The proper way is to knock at the patient's door, come in and introduce yourself. Ask them their name and explain the procedure that you'll be doing.
So, if it is an inconvenient time for the patient to take the x-ray, unless it is an urgent procedure, then you can come back, reconvene with with the nurse and the patient, and take the x-ray later.
Okay. Hi, it's like, so we're gonna get a chest x-ray. What's your name and birthday?
No habla English.
Okay, is it okay?
What's going on?
She doesn't speak English.
Are you kidding me?
I know.
Another one? Oh.
We'll be back. Okay.
What we did wrong there is we disrespectful to the patient because they couldn't speak English. We have to make sure we treat every patient, no matter their religion, ethnicity, or what language they speak, with the dignity and respect they deserve.
Oh, hey, I'm here. I'm going to do your x-ray. I need you to put this on. I don't have a lot of time, so if you could hurry, that would be great. No, 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 that is unacceptable.
Keep in mind that some patients are anxious before a procedure, and keep it also in mind their modesty. Also, provide them with a clean, folded gown, not one that's been dropped. Hey, how's it going? I'm just gonna check your vitals.
What? I can't hear you. Can you speak up? What are you doing?
So, just normal procedures, you know.
I'm cold. It's really cold in here.
Can you just,
How long is this
for
going
a
to take?
minute? It's like when communicating with elderly patients, keep in mind some may be hard of hearing and you may need to speak up. You may also need to repeat yourself a few times. Also be aware of the patient's comfort level, as they may require an extra warm blanket or padding.
So, Ms. Smith, before I take this x-ray, I have to make sure there's no chance of pregnancy, but I assume there isn't, because there isn't a Mr. Smith in the picture.
There is a chance that I could be pregnant.
Really? Have you heard of Jesus?
No, 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 that was unacceptable. Being respectful of the patient's lifestyle choices is important. We want to make the patient feel comfortable at all times and to feel like we're not being judgmental towards them. We want to make a sincere attempt to have a positive interaction with our patients. We want to make sure that we introduce ourselves, that we know their name, and we make them as comfortable as we can through the examination. We want to always show them respect and the dignity that they deserve.
The patient feels more comfortable, they're more willing to bring up their concerns and their symptoms with you, and they're more willing to come back to the hospital in future emergencies.
Remember you're aided when communicating with your patient. Make sure to knock before you walk into the patient's room. Acknowledge them and introduce yourself. Explain the duration of the procedure and what all it's going to entail. And don't forget to thank them at the end.
Thank you and have a nice day. Bye.